السلام عليكم ورحمة الله تعالى وبركاته. Anterior abdominal wall. The anterior abdominal wall consists of many layers, from superficial to deep, include skin, superficial fascia. The superficial fascia in the lower part of the abdomen differentiated into two, outer fatty layer and inner membranous layer. After the superficial fascia, you find directly muscle. So there is no deep fascia in the abdomen. The muscles include external oblique. When you remove, you find internal oblique. When you remove, you find transversus abdominis. Then you can find transversalis fascia. Deep to it, extraperitoneal fat, and then parietal peritoneum. Here is the layer of the abdomen, which include from superficial to deep, as I mentioned, skin, superficial fascia, which differentiate into outer fatty and inner membranous. Then you can find muscles, external oblique, internal oblique. This is the external, this is the internal, this is the transversus abdominis. Then you find the fascia transversalis, then extraperitoneal fat, and then the parietal peritoneum. The abdomen is divided into 9 regions by 2 vertical planes and 2 transverse planes. The 2 vertical planes include the mid-clavicular line. Mid-clavicular line which pass through the middle of the clavicle. Here, the 2 mid-clavicular line. Also, you can use the subcostal line. The subcostal line which pass below the lower margin of the rib and intertubercular line which pass through the two tubercle of the iliac crest. Also, you can use another transverse line such as transpyloric line. Transpyloric line which is located midway between the jugular notch and symphysis pubis. An interspinous line which passes across the anterior superior iliac spine. So, by using this line, we can divide the abdomen into 9 regions, which are epigastric region, umbilical region, hypogastric region. On each side of the epigastric region, there is left and right hypochondrium. On each side of umbilical region, you can find the right and left lumbar region. On each side of hypogastric, you can find the right and left iliac region. We divide the abdomen into region for description position. For example, we describe that the stomach located in left hypochondrian epigastric region and the spleen located in the left hypochondrium. Okay? Also, the abdomen can be divided into 4 quadrants by using the median plane, which divides the body into two halves, and transumbilical plane, which cross the umbilicus. And the umbilicus here itself, it varies between the subject. Here the abdomen, by these two lines, it divided into 4 quadrants. Right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. The muscle of the anterior abdominal wall. The muscle of the anterior abdominal wall include first, it look like sheath arranged into 3 layers. External oblique. Here is external oblique. When you remove the external oblique, you can find internal oblique. When you remove, find the transversus abdominis. This 3 muscle present into 3 layers. We can differentiate between them by the direction of the fiber. External oblique run downward, forward, and medially. Internal oblique run upward, forward, and medially. Transversus abdominis, it runs transversely. In the midline, you can find 2 muscles, rectus abdominis, and here a small muscle known as pyramidalis. This pyramidalis not present in all subjects. It may be absent in the other subject. Let us start one by one. External oblique muscle. As you see in this picture, the muscle here has muscle fiber, and towards the midline, it replaced by fibrous tissue. This fibrous tissue is thin and known as aponeurosis. The external oblique muscle originates from the last lower 8 rib. From the lower 8 rib. So it originates, we have 12 rib. The last lower 8 rib, that means from the 5th to 12th rib, and inserted into iliac crest, linea alba, and pubic tubercle. As you see here, this line located in the midline, known as linea alba, also inserted into hip bone here, known as anterior superior iliac spine, and inserted into pubic tubercle. The external oblique has 3 lower margin, known as inguinal ligaments. The inguinal ligament is the lower 3 margin of the external oblique muscle. It extends between the anterior superior iliac spine and symphysis pubis. Here the lower surface roll on itself to form the inguinal ligament. So what is the inguinal ligament? Inguinal ligament is the thickened inferior border of external oblique muscle, which extend between the anterior superior iliac spine and pubic tubercle. Important terminology: midpoint of inguinal ligament. As we mentioned, the inguinal ligament extends between the anterior superior iliac spine and pubic tubercle. When we say midpoint of inguinal ligament, it is midway between anterior superior iliac spine and pubic tubercle. When we say mid-inguinal point, this is midway between anterior superior iliac spine and symphysis pubis. Okay? Also, from the external oblique muscle, there is the fiber which run backwards to attach to the superior pubic ramus. Here it forms ligaments known as lacunar ligaments. So, this is a fiber of the external oblique muscle which run backward to the superior pubic ramus to form what? To form lacunar ligaments. These lacunar ligaments, the fiber here, extend superiorly along the pectineal line to form pectineal ligaments. So again, here is the inguinal ligament. What is the inguinal ligament? Lower free margin of external oblique, which extend between the anterior superior iliac spine and symphysis pubis. The fiber here extend backward toward the superior pubic ramus to form lacunar ligaments and extend and continue to extend along the pectineal line to form pectineal ligaments. Okay? Now you can differentiate between inguinal ligament, lacunar ligament, and pectineal ligaments. Okay? Now we finished from the external oblique. Let's move to the internal oblique. The internal oblique, the fiber run upward, forward, and medially. This muscle originates from inguinal ligament, from the iliac crest, from the lumbar fascia, and inserted into last 3 ribs. That means it originates in the rib number 10, 11, 12, and also inserted into linea alba and pubic crest. Here is the internal oblique muscle. Originate inferiorly from the inguinal ligament, from the iliac crest, from lumbar fascia, and inserted into the last rib, into linea alba. Okay? The transversus abdominis as the internal oblique. It originates inferiorly from the iliac crest, inguinal ligament, from the lumbar fascia, and the last 6 costal cartilage. From the rib number 7 to 12, from the costal cartilage from 6 to the 7. From the 7 to 12. It inserted into the linea alba and pubic crest. We have conjoined tendon. The lower free margin of the internal oblique and transversus abdominis fuse together to form the conjoined tendon. Here is conjoined tendon, the lower margin of the external oblique and internal oblique arch above in the male above the spermatic cord and then attached to the pubic crest. Here, when it attached the lower part here, when it fused and attached to the pubic crest, known as conjoined tendon. So, what is a conjoined tendon? Is a lower free margin of internal oblique and transversus abdominis, where it arches in the male above the spermatic cord, on in the female above to the round ligament of the uterus. This conjoined tendon attached to the pubic crest and pectineal line. Okay? Rectus abdominis present in the midline only, not throughout the abdomen, just in midline. This rectus abdominis muscle originates inferiorly from the pubic crest, pubic tubercle, symphysis pubis, and inserted into the costal cartilage from the 5th to the 7th. Here is rectus abdominis muscle originate inferiorly from pubic crest and symphysis pubis here. Inserted superiorly in the rib in the costal cartilage from the 5th to the 7th. This muscle may be absent, known as pyramidalis, which is absent in 20% of subject. This small muscle originate from the pubic bone and inserted into linea alba. Linea alba is a fibrous band extend from the symphysis pubis to the xiphoid process. Nerve supply of anterior abdominal wall. External oblique, internal oblique, transversus abdominis, supplied by thoracolumbar nerve. Thoracolumbar nerve include the last 6 thoracic spinal nerve. So it's supplied by the last 6 thoracic spinal nerve plus L1. L1 it gives rise to 2 nerves, which are iliohypogastric and ilioinguinal. Regarding the rectus abdominis muscle, supplied only by the lower 6. Thoracolumbar nerve, last 6 thoracic nerve, while the pyramidalis supplied only by subcostal nerve or the 12 thoracic spinal nerve. Is it clear? External oblique, internal oblique, transversus abdominis supplied by the last 6 thoracic spinal nerve plus L1, while the rectus abdominis delete L1 just by the last 6 thoracic spinal nerve. Pyramidalis by T12 subcostal nerve or the 12 thoracic spinal nerve. Okay? What are the functions? Here we say function and action of the muscles. Regarding the action, this muscle flexed the trunk and lateral rotate the trunk. Regarding the function of the muscle, this muscle supports the viscera, protect the abdominal viscera, and assist in deep inspiration and deep expiration. During deep inspiration, the muscle relax and the diaphragm descends, so it increases the vertical diameter of the thorax. During forced expiration, such as in the cough, labor, the muscle compressed the abdomen and sent the diaphragm.